Brunswick. Bonjour tout le monde et bienvenue à cette mise à jour sur le COVID-19 au Nouveau-Brunswick. Les porte-paroles aujourd'hui sont la médecin hygiéniste en chef, la Dr. Jennifer Russell, et l'honorable Dominic Cardy, ministre de l'Éducation et du Développement de la Petite Enfance. Good afternoon, everyone, and welcome to today's update on COVID-19 in New Brunswick. Speaking on behalf of the province today are the province's Chief Medical Officer of Health, Dr. Jennifer Russell, and the Honorable Dominic Cardy, Minister of Education and Early Childhood Development. Dr. Russell.
Good afternoon. Bon après-midi à tous et à toutes. Aujourd'hui, je veux m'adresser directement aux jeunes du Nouveau-Brunswick et souligner le rôle essentiel qu'ils peuvent jouer pour renverser la tendance à la hausse du nombre d'infections à la COVID-19 dans la province. Les discussions sur les COVID-19 sont souvent axées sur les membres les plus vulnérables de la société, soit les personnes fragiles, les aînés et les personnes ayant des problèmes de santé chronique. Au cours des derniers jours, de plus en plus de citoyens du Nouveau-Brunswick âgés de moins de 30 ans contractent le virus et le transmettent aux autres. On voit cette transmission, cette transmission dans le même âge en Nouvelle-Écosse aussi. When we talk about COVID-19, we frequently focus on the most vulnerable members of our society, the frail, the elderly, and those with chronic medical conditions. But in recent days, it is New Brunswickers under the age of 30 who are contracting this illness in growing numbers and passing it to others. We are seeing a similar pattern of transmission in Nova Scotia and elsewhere in the country. Since the pandemic began in March, people under the age of 30 have comprised only 29.4% of all confirmed COVID-19 cases. But currently, they make up more than half of our active caseload. So 53 of 94 active COVID-19 cases in New Brunswick, or 56.3%, are under the age of 30. Children, teens, and young adults are not immune from this disease, and they can become gravely ill and suffer long-term damage to their health. And they can and do pass this virus to others who are less able to fight its effects. Young people and young families can help stem the spread of COVID-19 infections by wearing a mask when in public, avoiding large gatherings, and reducing your close contacts, meaning the people that you spend time with without wearing a mask. You can break the chain of infections now spreading in our province and help return all regions of New Brunswick into the yellow phase of recovery. Aujourd'hui, il y a 6 nouveaux cas confirmés de COVID-19 au Nouveau-Brunswick. Dans la zone 2, qui comprend des comtés de Saint-Jean, Kings et Charlotte, il y a 4 nouveaux cas, 2 personnes âgées de moins de 19 ans, une personne âgée de 20 à 29 ans, une personne âgée de 30 à 39 ans. Dans la zone 1, la région de Moncton, il y a 2 nouveaux cas, soit 2 personnes âgées de 20 à 29 ans. Il y a présentement 94 cas actifs de COVID-19 dans la province, mais aucun d'entre eux n'est hospitalisé à l'heure actuelle. D'autres cas feront surface au cours des prochains jours. Il y a présentement un nombre record de citoyens qui s'isolent dans l'ensemble de la province à la suite d'une exposition possible au virus. Le risque que d'autres cas se signalent est donc très élevé. Today, there are 6 new cases of COVID-19 in New Brunswick. In Zone 2, which is St. John, Kings, and Charlotte counties, there are 4 cases. 2 individuals under the age of 19, 1 individual aged 20 to 29, 1 individual aged 30 to 39. In Zone 1, which is the Moncton region, there are 2 new cases, both individuals aged 20 to 29. There are now 94 active cases of COVID-19 in the province, with no cases currently hospitalized. There will be more cases in the days ahead. We actually have a record number of people self-isolating across the province right now, and therefore the risk of further confirmed cases is very high. The risk that our hospitals may be quickly overwhelmed is also high. We are seeing this in other provinces. Alberta has now moved past Ontario and Quebec as the province with the greatest number of active COVID-19 cases in Canada. Le nombre de décès attribuables à la COVID-19 qui ont été signalés au cours de la dernière semaine au Manitoba est plus élevé que pendant le reste de la pandémie. When hospitals are full of patients being treated for COVID-19, that means that there aren't enough beds and ICU beds and hospital staff to treat other illnesses and provide other healthcare services. We owe a great debt of thanks to those working on the front lines of the pandemic in hospitals and adult residential facilities, in public health offices, schools, and other institutions. I really, truly want to thank everyone in New Brunswick for all we have achieved thus far. We could not have done it without everybody working together. Nurses, doctors, paramedics, teachers, contact tracers, and many others are working tirelessly in high-stress situations to keep everyone safe. Our gratitude for their service and sacrifice is boundless. The best and most effective way we can demonstrate our gratitude is to follow public health guidance every day, no matter where you live in our province. And also be compassionate. It is so important. Compassion for yourself as well as compassion for others. And if you need extra support from a mental health perspective, please tap into our resources. There are many, so please go to the website and look for those resources. You can also call 211 for extra help when it comes to mental health and finances, etc. Wear a mask when you go out in public and maintain 2 meters of physical distance. I think some people feel like they don't have to physically distance if they're wearing a mask. You absolutely do. You have to remember that these measures are most effective when they are done together. Not one single measure works in isolation by itself. They have to be used in combination to have the most protective effect. La façon la plus efficace de démontrer notre gratitude consiste à suivre les directives de la santé publique tous les jours, peu importe où vous habitez dans la province. Portez un masque en public et maintenez-vous à une distance d'au moins 2 mètres des autres en tout temps. Et je vais répéter, portez le masque et maintenez-vous la distance au moins de 2 mètres. Il faut que ça soit fait ensemble. N'oubliez pas que les mesures sont les plus efficaces quand elles sont appliquées toutes ensemble. Les mesures ne marchent pas tellement bien quand elles sont faites en isolation l'un de l'autre. Those living in Zone 1 and Zone 2, which remain at the orange phase of recovery, should wear a mask outdoors as well as indoors. All New Brunswickers can practice effective mask use. When you are arriving back in New Brunswick from Nova Scotia, from the Halifax area, people should self-monitor for symptoms of COVID-19 for the first 14 days. Please get tested if you have symptoms. And you have to behave as if you have come from an orange zone in New Brunswick. Remember to assume that others around you have the virus and act accordingly. Anytime we've seen cases evolve in an outbreak situation in a zone, people were not expecting to be infected. They were not expecting to pass along COVID-19 to their family and friends. But it's happening, and we have to be aware. We can all press the pause button right now and just take stock of where we've come from and what's happening in the rest of the country and in the rest of the world. So again, particularly for young people right now who are getting infected in larger numbers, it's really important. So if you know somebody in that age category, because I know there's only about 13,000 people who watch this every day, and there are 750,000 or more people in this province. So take the time to tweet or send a message on Instagram or Facebook or whatever. Reach out to the people that you know in this age group and help them be as safe as possible at this time. You know, I was young once. We were all young once. I won't say how long ago that was, but it is natural to assume that, you know, you have unlimited immortality. So we feel like we're immune to harm at those ages. But this pandemic is proving how wrong those beliefs are. So again, reach out, engage, educate, involve, help people become part of the solution. I ask all New Brunswickers to watch the updates and whatever information you can share from our website, our webpage. We have social media tweets as well. We want everybody to have the right information to make good decisions. En réduisant le nombre de contacts étroits, et ça veut dire les gens que vous passez du temps avec sans masque, en évitant les rassemblements et respectant les autres consignes de la santé publique, vous pouvez vous protéger contre le COVID-19. Le plus important, c'est que vous pouvez ainsi protéger votre famille, vos voisins, vos amis, vos entreprises, vos écoles, vos hôpitaux. Faites-le pour vous-même, mais faites-le aussi pour ceux qui vous entourent. By reducing your close contacts, avoiding large gatherings, by practicing saying no. I have a friend who has a really good line when she's asked to do something that she's not comfortable doing or can't do for whatever reason. She just says, that doesn't work for me. So have a rehearsed line where if you're uncomfortable and you really don't want to participate in a gathering, or you've changed your mind about hosting a gathering, be comfortable in stating that you can't or you won't in a very practical way. And following other public health guidance, you can protect yourselves from COVID-19. More importantly, you can protect your families, your neighbors, and your friends. Do it for yourselves and do it for everyone around you. We do not want to be engulfed by the second wave. This wave is engulfing the rest of Canada right now and indeed the world. We have managed to succeed thus far, so let's dig deep and do this together, and I know we can get through this. Thank you very much.
Good afternoon, everyone. Bon après-midi et bienvenue tout le monde. Before we start, I had a couple of people ask why folks take off masks when we do these briefings, partly so folks who are hard of hearing and so on at home can more easily understand what we're saying, and we're making sure we preserve all the public safety and public health guidelines that Dr. Russell and her team have put in place. Le samedi 21 novembre, nous avons été avisés du premier cas confirmé d'infection de la COVID-19 dans une école à la suite des éclosions survenues dans les zones 1 et 2. So as of last night, we have a total of 7 schools who've been impacted with positive cases of possible exposure across zones 2 and 3. In addition, two childcare centers have been impacted over the last week. I understand the fear and concern that this causes among many families, people who have connections to our school system in particular. But we have reason to be optimistic. Throughout all of our planning, in addition to the experiences that we've already gained through previous outbreaks in zones 1 and 5 in October, they've allowed us to be able to launch a coordinated response to rapidly evolving situations concerning the pandemic. During that outbreak, we had 13 schools in zone 5 impacted, positive cases and positive exposures, possible exposures. But by following the plan that we put in place over the summer, and with the cooperation of the public, Zone 5 was able to return to yellow within 4 weeks. In the summer, I was clear. I said there will be more cases and there will be more deaths in New Brunswick as a result of COVID-19. This is not a surprise. We took that time, what now seems like a fairly relaxed period in the summer, to develop a plan developed at a time when we had the luxury of seeing the virus far away from our borders for the most part. Now we're seeing that plan in action, and we're seeing that on first contact with the virus, thanks to the work of the contact tracers and others across the province, and most importantly, the citizens of this province, that we were able to push COVID-19 back. But today, we do have a handful of classes at Hampton Middle School, Lakefield Elementary School in Zone 2, and at Centreville School and Montgomery Street School in Zone 3, who'll be learning from home over the course of the coming week or two. And we'll take advice from public health as we move forward to determine the best time for those students to return. If any families experience any difficulties connecting to remote learning during this time, we do have remote IT services available to assist you. So the Bell Call Center can answer any questions about Office 365, Teams, D2L, or Wi-Fi connections, and their number is 1-833-453-1140. Je suis vraiment content de constater que nous avons pu jusqu'à présent réduire au minimum les répercussions sur l'apprentissage scolaire du COVID-19. Cela dit, la situation continue d'évoluer chaque jour, de l'heure à l'heure. Et c'est pourquoi nous demandons aux familles de rester vigilantes et d'être très attentives aux symptômes qui pourraient apparaître. Si vous avez les doutes, si vous n'êtes pas certain, il faut aller faire des tests de dépistage. Je vous demande au cours des prochains jours à continuer à bien vous renseigner en prenant connaissance de tous les messages d'information transmis par les responsables de l'école, du district scolaire ou des autorités de la santé publique. From the department side, we will keep you up to date with as much information about learning as possible as the situation continues to evolve. And so if you or a close family member has been in close contact with any of these cases, you will be notified by public health for contact tracing. Otherwise, we're committed to protecting the privacy, of course, of our students and staff per the Personal Health Information Privacy and Access Act. So please remember that if you don't hear from public health, no news is good news. School is so incredibly important for the well-being and mental health of our students. So we've been working closely with the districts, with schools, with public health and other partners over the past few months to be as prepared as we possibly could be in the face of a disease that we're all learning about on a day-to-day basis. Unless you've heard from public health, students need to continue going to school. I know this is an incredibly stressful time, but we have not seen any evidence of student-to-student transmission in schools at this point. The guidelines that we put in place back at the beginning of term that many of you wrote to me and said, this seems somewhat excessive. We have no cases in the province. Why do we have these restrictions in place? Those restrictions were put in place in September for today in the zones affected. They're put in place to make sure that in the face of rising number of COVID cases, we didn't see schools subjected to the additional disruption caused by a change in public health and safety protocols. We want to make sure that our students can continue to learn safely despite this pandemic. So our goal has always been to minimize risks and to help support contact tracing for exactly the sort of scenario that we're now experiencing. But let me also be extremely clear that if we see evidence of cases increasing and if public health believes that the triggers that would require a move to a red phase have been met, that this government and myself as Minister for the Department of Education and Early Childhood Development will not hesitate for a moment to make the necessary call to move our schools to online learning, the same way that I did not hesitate to order our schools closed in March when we were facing a disease about which we knew little and for which at that point fear was understandably great. So à l'heure actuelle, en accord avec la mise en place de notre planification et de notre préparation, aucune transmission entre les élèves n'a été signalée dans les écoles. Il est important de le redire. Notre plan pour affronter la COVID-19 et la pandémie fonctionne jusqu'à présent. Nous avons réussi à contenir les éclosions dans les écoles durant les premiers mois de la rentrée scolaire. Et nous devons continuer à redoubler l'effort à nous entraider. Il faut tenir bon et agir dans un esprit de collaboration. The level of commitment and collaboration across government and the education to help keep classrooms safe and healthy is to be commended. Districts, trade unions, parents, New Brunswickers as a whole have recognized the incredible importance of our education system during this time of disruption and anxiety. So I want to thank all the excellent work that's been put in over the past few days, particularly over the weekend, by the contact tracers and other officials with public health and all the people in the school community who went above and beyond to help public health in their important work. Public health's quick work on testing and contact tracing has enabled us to keep schools open and students learning safely. We need to continue to stay vigilant inside and outside of the classroom. We need to continue to work now more than ever to keep our schools safe. This has been an incredibly strange year filled with new challenges, and it's required us to be flexible, to adjust to quickly changing circumstances. But it's worth as well taking a moment to praise our young people who've responded to these incredible disruptions in their lives with a level of cheerful resilience that I think is an inspiration to all of us. J'encourage chaque personne à continuer à jouer son rôle et à faire sa part pour diminuer les risques autant que possible dans nos écoles et dans l'ensemble de la province. Soyez gentils, bienveillants, soyez patients et prenez le temps de prendre soin de vous-même et de votre famille. Il est important de bien s'occuper de votre santé mentale et physique. And I want to remind families that if your child is struggling, a virtual counseling program is available through our schools. A variety of supports and programs are available in schools. And there are other resources available on the Government of New Brunswick's COVID-19 website. We have seen great success to date in battling this pandemic. And that has been because New Brunswickers have listened to the advice from public health. Repeat their message. If you can, stay home. If you can work from home, do that. If there's a social gathering you can skip, skip it. When I get emails from people saying that because the school Christmas social was canceled, that parents are taking it upon themselves to organize those socials outside of school, you are sending your children a dangerous message and possibly risking them becoming the vectors for a deadly disease. We have got to take this virus seriously. If we continue to take it seriously, our hospitals can stay open, our schools can stay open, and we can move towards a world just 100 or so days away now when a vaccine or vaccines start to be rolled out and we can start to put this pandemic behind us. Until that date, listen to the advice from public safety, listen to the advice from public health, and please continue to wear a mask, practice social distancing, so that in one happy day in the not too distant future now, we can say we don't need to wear masks. We can hug people rather than worrying about how close we are to them again, and we can get on with the important work of building New Brunswick back out of a disease that has changed the world. Merci beaucoup, et maintenant nous sommes heureux de prendre les questions. Oh, sorry. I'm getting in trouble. Usurp Bruce's role here.
Merci, Monsieur le Ministre Cardy and Dr. Jennifer Russell. Thank you, Minister, and Dr. Russell will now proceed with questions from the media. Each reporter will have one question. You have the right to pose your question in the language of your choice. Nous allons maintenant procéder aux questions des journalistes. Vous avez toujours le droit de poser vos questions dans la langue de votre choix. Chaque journaliste aura une question. Vicky Hogarth, Charlotte County TV.
Thank you, Bruce. My question is for Dr. Russell. Dr. Russell, we've heard from New Brunswickers who registered online up to 3 days ago and still haven't been contacted for an appointment by public health to get tested. How is public health working to deal with this delay, and is there a backlog of testing that needs to be done and processed?
Hi, Vicki. So we are working on the backlog, and in terms of what that means, that means that we do have a priority system when we do testing. So when zones go to orange, it changes how many pre-op tests we do, and they have to be prioritized. And anybody that public health refers for testing, they have to be prioritized. And so in terms of the priority cases, those ones are actually getting done. So the rest are going to get done, and we have some information from Horizon in terms of what they're able to provide to address the backlog, so especially in the St. John area. So a second assessment center is being set up on the Rothsay Road, and that should be operational tomorrow. And additional capacity has been set up at the Rope Walk Assessment Center and is operational.
Thank you, Doctor. Thank you, Ms. Hogarth. Jean-Philippe, Radio-Canada.
Oui, bonjour. Une question pour Mme Russell. Moi, j'aimerais tout simplement savoir, avec ce nouveau cas aujourd'hui, est-ce que vous avez l'impression qu'on est en train d'aplatir la courbe? Est-ce que vous êtes heureuse de ces nouveaux résultats?
J'ai seulement entendu la partie où ce que tu voulais savoir si je croyais qu'on on va aplatir la courbe avec les nombres de cas qu'on a aujourd'hui. J'ai pas encore entendu la dernière partie.
Oui, donc, je vais répéter ma question. Ce que je veux savoir, c'est est-ce que vous êtes heureuse avec comment vous vous sentez avec les nouveaux résultats qui sont beaucoup plus faibles que ce qu'on voyait samedi, on avait 23, aujourd'hui c'est rendu à 6. Est-ce que vous êtes d'avis qu'on est en train d'aplatir la courbe?
Ben oui, je suis toujours heureux quand que les nombres sont plus bas qu'ils étaient avant. Ça, c'est une bonne direction pour aller. Mais on sait qu'à ce moment-ci, on a environ 1000 personnes qui sont à la maison en isolement pendant 14 jours. Alors, je serais très, très, très contente et très, très, très heureuse si, après 14 jours, on voit que la courbe est complètement aplatie et les zones qui sont dans la phase orange pourraient retourner à la phase jaune.
Merci, Monsieur. Natalie Sturgeon, Telegraph Journal.
Thanks, Bruce. My question is for Dr. Russell. Today, the mayor of St. John, John Darwin, spoke about the growing support for a lockdown under the red phase in Zone 2, including several businesses
in the uptown where the majority of these public exposures exist to protect people and keep their staff safe. Why has public health placed the onus on small business to protect the public instead of implementing a 2-week lockdown under the red phase?
So when we had our outbreaks in the north of the province and also in the Moncton zone previously, we felt like we were able to very successfully manage the outbreaks in the orange phase. Obviously, there are many things to consider when we implement any protocols or measures. They are based on epidemiological indicators, public health indicators, as well as hospitalization and hospital resource indicators. So that is what we do, that is what we base our risk assessments on when we make a decision to go to a different phase. So because we were able to successfully manage those outbreaks in the orange phase, we know that if we can do that successfully like we have, then we are protecting the social determinants of health. We are protecting education, we're protecting people's incomes, we're protecting people's mental health, et cetera. So I understand the worry and concern, but again, we will do everything in our power to manage the outbreaks in the orange phase. But we are evaluating this situation every single day. It's a very fluid situation, and we are working with all of our partners with respect to Horizon, Vitalité, public health, and all of government in terms of the departments that are implicated. So make no mistake, if we meet the indicators in terms of having to go to the red phase, we certainly will. But it is a last resort in terms of, based on our indicators, we really want to exhaust the other phases in terms of our response to be able to successfully manage outbreaks in the orange phase, again, so that we have that balance between protecting the social determinants of health as well as protecting people from COVID-19 and overwhelming the healthcare system.
Thank you, Doctor. Thank you, Ms. Sturgeon. Savannah, Telegraph Journal.
Hi there. You spoke earlier to the risk of overwhelming our hospital system. I know you guys have put out modeling for projections before on how certain numbers of cases will impact our system. Do you plan on releasing similar modeling, just given that we're having kind of a resurgence at this point?
Well, in the outbreak in Zone 5 previously, and the other outbreak in Zone 1, we did have a different demographic that was involved in terms of what we were projecting for hospitalizations, et cetera. Because in these particular outbreaks currently, the age group is younger, so it is a different type of projection. I don't know if they have those calculations, if they would be made available, but certainly, again, they look at their hospital capacity currently as it stands right now. What the orange level of response does to the backlog of other services. But the other thing that we look at, again, is hospital resources from a staff perspective. So these are all the things that we take into account. It's not just the modeling of how many hospital beds, but it also includes human resources and the ability to provide healthcare services.
Thank you,
There's
Ms.
no
Saab.
plan to
Thank
share
you.
that publicly? Sorry, there's no plan to share that publicly?
Oh, the triggers are online that include the hospital indicators.
The modeling, though, the modeling.
I don't
numbers of cases and the hospital system. Is there a plan to share that publicly?
I don't know if they've actually done modeling in this particular case. All I know is that they are looking at hospital capacity from the bed and ICU capacity, but also from their human resource capacity in terms of how many people are self-isolating and what services are impacted currently.
Laura Brown, CTV.
Hi there. I'm wondering if, because Nova Scotia has moved to mass testing for asymptomatic people, and Campbellton, we did mass testing in that area. I'm wondering if you're considering that in the St. John's area, and if not, why?
Hi, Laura. We did that up north a couple of times, actually. But that, again, very different type of outbreak. That had many, many different settings of exposure in terms of the community, the way that the transmission was happening. And I don't think we're at the point where we want to do any kind of mass testing at this point, for the simple reason because all of the cases in the St. John zone are all linked. So there is no unlinked chains of community transmission that we're seeing the way we saw up in the Zone 5 outbreak. So I hear what you're saying in terms of, yes, we did mass testing, but the reasoning behind it was because we had those unlinked chains of community transmission, which we do not see in the St. John zone in that outbreak. Every single case is linked.
Thank you, Ms. Brown. Thank you, Dr. Sébastien Lechance, l'Acadie Nouvelle.
Oui, oui, bonjour. Ma question est pour Monsieur Cardy. On l'a vu depuis l'avènement de la COVID-19 que les classes, l'enseignement en classe se déroule très différemment là, depuis le printemps dernier. Alors, je voulais voir avec Monsieur Cardy si, par exemple, le fait qu'on ait réussi à mettre de l'avant une certaine forme d'enseignement à distance, en ligne, si, par exemple, lors des jours de tempête de neige ou de problèmes techniques où les écoles ferment, si, M. Cardy, si le ministère serait d'avis qu'on pourrait possiblement là, implanter cet enseignement-là à distance là, pour faciliter un peu les apprentissages des jeunes.
Merci pour la question. Sur la question des journées de tempête, ça c'est quelque chose qui est protégé par les conventions collectives aujourd'hui. Alors, c'est quelque chose qui clairement va être dans les négociations avec les enseignants-enseignantes, mais je veux souligner que la raison pourquoi beaucoup des enseignants-enseignantes sont assez énergétiques dans leur défense de prendre les journées de tempête est à cause des énormes montants de travail qui étaient imposés sur eux dans les dernières années, qui n'étaient jamais prévus. Et des fois, ils commencent de voir les journées de tempête comme une journée pour rattraper, pour faire les planifications des leçons, de compléter les bulletins, etc. Alors, absolument, on va le discuter, mais pour cet hiver, on continue comme d'habitude. Mais absolument, c'est clair que la transition aux formations à la distance, c'est clair que ça offre les manières d'adresser les problèmes créés par notre climat. Just very quickly in English, in terms of snow days are covered under the collective agreement, so we don't see any likelihood of change this winter, but I want to underline the reasons why so many teachers defend snow days is because it's one of the few days they have to catch up on work, and the amount of work that teachers are expected to do on a routine basis has been vastly increased without any real recognition over the last number of years. And those are both things, snow days and that amount of work done without, expected to be done without the time to do it, are both things that I'm sure will be addressed in the coming collective bargaining process with the teachers' unions. Merci.
Thank you. Isabelle Legier, CBC.
Hi, my question is for Mr. Cardy. In light of the fact that you dedicated much of your address today to addressing youth and young adults, are you concerned that some people employed by the Department of Education may not be following the orange phase rules during their off hours at restaurants or bars, for example? And if so, what are you doing about it?
Well, I am not the Minister for Public Safety, and I have no responsibility for what staff do when they're not working. However, I can tell them that they better shape up. That if I find out anyone in my department has been breaking the rules and not following the requirements imposed by the orange phase, then I would certainly expect them to be ready to take the consequences of breaking the rules that are there to protect all of us. J'espère que c'est assez clair que si j'entends qu'il y a les employés du ministère de l'Éducation et de le développement de la petite enfance qui sont en train de briser les règles dans la phase orange, ils ont besoin d'être prêts pour soumettre aux conséquences. On a besoin de suivre les règles qui sont en place, seulement pour les prochaines centaines de jours. Et s'il vous plaît, pendant les prochains mois, suivre les règles.
Merci. Thank you, Minister. Timothy Jakes, Campbellton Tribune.
Yes, question for the Minister. Paragraph 10C of the November 20th emergency order says that residents of Listigouche First Nation and of Pointe-à-la-Croix, Quebec, who have pre-registered and been approved can enter New Brunswick to attend school. There's nothing in there that makes us contingent on anything the Quebec government does or doesn't do. So why is this exemption not being followed in the case of high school students, although I understand it is for K-8 students?
Thanks for the question. We left that exemption in place so that if the government of Quebec starts to see reason and starts to do the right thing, that we can allow students from Listigouche back into our schools tomorrow without having to wait for a renewal of the order that usually takes place only every 2 weeks. So that's the reason for it staying in there. The emergency order is not the only government that dictates the policies of the government of New Brunswick. We make decisions in addition and on top of that. So I've been very clear. We welcome the students from Listigouche back the moment the government of Quebec restores the checkpoint at Pointe-à-la-Croix to protect New Brunswick from COVID-19. We are seeing the impacts of rising case numbers around our region and around the world. We do not want more of those cases here in New Brunswick. That's where the virus comes from. It comes from outside. We had 0 cases a few weeks ago. So we keep it out by following the rules. Vraiment en français, on va absolument laisser les étudiants de Listigouche retourner à l'école aussitôt que le gouvernement du Québec est prêt à remettre en place une pointe à contrôle pour assurer la sécurité de la province de Nouveau-Brunswick. On voit que les cas arrivent de l'extérieur. La seule manière de nous protéger est de restricter l'accès aux provinces. Ce n'est pas parfait. Je suis tellement triste qu'on a besoin de faire ça à ce point, mais le gouvernement du Québec a besoin de prendre son responsabilité. L'éducation est 100% responsabilité provinciale. Nous sommes prêts. Nous attendons le gouvernement du Québec.
Marie Sutherland, CBC.
Hi, good afternoon. Question for Dr. Russell. We keep hearing about confusion around the messaging. The Premier himself admitted this yesterday around things like when to wear masks, around bars being allowed to stay open, but individuals have to limit their activities. So given your stated concern for the growing numbers of cases among youth and young adults, I'm wondering, will you be clarifying your messaging in any way, and will you be trying other channels or methods to reach this audience?
So we know that that messaging is specific to that group, that age group, and they do have different methods that communications is working on to reach that target audience. So there are many, many different ways of doing that with respect to social media, et cetera. So that is happening. With respect to, you had a question about masks and whether or not people had to socially distance as well as wearing masks, or, I'm sorry, I didn't hear that part of the question.
I was just sort of basically setting up the general confusion around a number of aspects of the messaging and the rules. So I was wondering if there were some changes coming to this messaging, maybe some clarifying and tightening up.
With respect to masks and when to wear, because I know there has been confusion about wearing masks outdoor in public spaces in the orange phase. So wearing masks indoors in public spaces in the yellow phase everywhere. And then if you're in an orange phase, then you need to wear masks outdoors at all times in public spaces. Does that help? And there will be more clarifying message about that, but that is the message.
Okay, thank you.
John Chillibeck, Daily Gleaner.
Yes, hi. Thanks for taking my question. Earlier, I believe when there was an outbreak in the Campbellton region, I had asked this question. I was wondering if it had changed at all. The businesses outside of the zones in orange, for instance, Fredericton, some businesses are now asking patrons if they're from those areas and asking them not to come if they are. Is this something that you recommend or you would dissuade businesses from doing?
I think in the healthcare system, it's really important that people be screened and have those questions asked. But outside the healthcare system, technically speaking, people who are traveling for essential reasons should be allowed to participate. Obviously, if they're coming from an orange zone, they have to wear their masks outdoors in public spaces as well as indoors in public spaces. So at this time, we're discouraging any non-essential travel outside of the orange zones. So, and anybody who's traveling for essential reasons, for instance, for healthcare services, they would be screened appropriately, again, based on the fact that they're coming from an orange zone. But there shouldn't be really questioning about that if people are following the guidelines of not traveling for non-essential reasons.
Thank you. Jordan Gill, CBC.
Yes, my question for the minister. With cases increasing at schools, are more parents keeping their children home from schools as a precaution? And are more teachers also requesting to teach from home? And at what point does this tip over into making more sense to close schools?
Thanks for the question. Certainly hearing from parents saying they're intending on keeping their kids home, and some teachers who are concerned. It's a moment to give a real shout out to the teachers and the other staff, the EAs, who are continuing to go to work and continue to go to work in Campbellton and Moncton and other places that have already been touched by COVID-19. So certainly some are making that choice. Many don't have that choice. Many parents are vulnerable economically themselves, may have jobs that don't allow them to easily take time off, don't have the ability to quickly and easily arrange childcare, a myriad of other reasons why staying in school is so important. The mental health impacts of being out of school, we've seen the reports of this arising around the world. So our goal is to keep our schools open as much as we possibly can based on the triggers that were established. The color phases are government creations based on trying to provide clear indications to the public, which sometimes, as Dr. Russell was saying, can get confused because, of course, they have to be changed and updated as the science and the information changes and is updated. But our goal is to continue to keep our schools open and safe as long as we can. And at this point, we are seeing no reason to close our schools. I know this creates stress for parents, and I can't imagine for those of you who have kids in the system, working in the system, the emotions that this must bring out. And we don't take these decisions lightly. There's no effort here to try and play with the lives or safety of any New Brunswicker. We're trying to make sure that we keep an incredibly important institution that has a lifelong impact on our young people open and accessible as long as we possibly can. Alors pour tous les parents, pour tous les membres de l'équipe professionnelle dans les écoles, on comprend l'anxiété qui est créée par cette situation. Et on va continuer de faire tout qu'on peut pour que les écoles puissent rester ouvertes et sécuritaires. Parce qu'on connaît le dommage qui peut être créé par la fermeture des écoles. Et alors, on va continuer jusqu'au maximum pour faire tout qu'on peut pour protéger nos écoles, pour protéger nos hôpitaux. Ça, c'est la manière qu'on peut survivre cette pandémie. Thanks.
Monsieur le ministre, Meg Cunningham, CHMA, Sackville.
Thank you. My question is for Dr. Russell. You mentioned in the last Campbellton outbreak that there were several unlinked chains of transmission for many weeks. To give us a sense of what we're looking at here, how many unlinked chains of transmission are there in Zone 1 and Zone 2 right now, and how long are these chains of transmission?
So in the Zone 5 outbreak that included Dalhousie, Campbellton, and Balmoral, there were about 5 unlinked chains of transmission at one point, but by the end of the outbreak, we were actually able to link them all. It just took a really long time to re-interview people and find those links. But at the time, because we didn't have those links, we were assuming that there was community transmission at that point. Thankfully, we were able to get that outbreak under control and succeed, and that was a great success. But now in the St. John zone, which is Zone 2, there are no unlinked chains of transmission. Every single case in St. John is linked. In Zone 1, in the Moncton zone, there are a couple of unlinked chains. I actually don't know how many cases are involved in each of the clusters. But again, contact tracing and interviewing is still ongoing, so that's why we haven't declared community transmission. Again, because of our lessons learned from the Zone 5 outbreak, that we can take a while. It can take a while before we can establish the links, but we are definitely still looking for them.
Thank you, Ms. Cunningham. Thank you, Dr. Tom Bateman, Times and Transcript.
Oh, hi there. I'm worried that, can you hear me?
Hang on one sec, folks.
That is not me.
Everybody, please mute your microphones. Tom Bateman.
Good. Hi. This question is probably best put to Premier Higgs, so perhaps Mr. Cardy can speak on behalf of the government. I talked to a business owner who was told by WorkSafe Brunswick it would take as long as 15 days to have a specialized technician entry into the province from Quebec cleared by the agency. He says this is unrealistic, especially in circumstances where a business may not be able to operate without an intervention from that out-of-province worker. And he says this is especially the case because bringing such a worker into PEI or Nova Scotia would only take a matter of hours. So where do issues like this rank on your government's priority list? And are you aware of a reason why this province's approval process appears to involve, more red tape than our neighbors? Thanks.
So you sort of hinted as to my likely answer to your question and your lead into it, which is I'm not Premier Higgs. And despite the many wicked smart people who work for me in the Department of Education and Early Childhood Development, I am unable to answer your question because it is not part of my portfolio and nothing that I have any knowledge to speak on. So I figured that in that case, saying less is probably saying more. Je n'ai pas vraiment la base sur répondre à ces questions, c'est hors de mon compétence comme ministre de l'Éducation et du Développement de petite enfance. Alors, ça sera la totalité de mon réponse. J'ai besoin de demander le Premier ministre ou le ministre responsable. Merci.
Simon Delat, Lacadie Nouvelle. Simon.
Oui, une question pour Dr Russell au sujet, donc vous avez au début de l'intervention aujourd'hui donné des recommandations pour les plus jeunes, les personnes de moins de 30 ans. Est-ce que vous avez des préoccupations par rapport à certains comportements particuliers, certains rassemblements particuliers lorsque vous avez mentionné un événement super propagateur la semaine dernière, est-ce que ça concernait aussi des personnes plus jeunes? Et finalement, comment faire passer ce message auprès des plus jeunes que vous souhaitez rejoindre aujourd'hui?
Alors, les comportements qu'on aimerait que tout le monde, n'importe quel âge, suit, c'est de porter des masques à l'intérieur et à l'extérieur si vous êtes dans la phase orange. Si vous êtes à la phase jaune, c'est tout le temps à l'intérieur. Ne pas participer à des rassemblages, à des réunions ensemble. Alors, ne pas rassembler, sauf qu'avec votre bulle d'un ménage. Sauf que si vous demeurez seul, et dans ce temps-là, vous pouvez avoir du support d'une autre personne ou bulle de ménage. Je crois que pour tous les gens, même tous les gens de tout âge, c'est la possibilité que vous serez infecté, que vous infecterez quelqu'un d'autre. La transmission est la possibilité tout le temps dans notre province, n'importe quel endroit que vous êtes. Alors, c'est toujours la possibilité et les comportements qu'on veut que tous les gens adoptent, c'est ceux qui vont vous protéger avant que le premier cas arrive dans votre communauté. Parce qu'après que le premier cas est arrivé dans votre communauté, c'est un peu trop tard que ça se peut que vous êtes déjà un contact étroit. Alors, quand vous enlevez votre masque à l'intérieur avec vos amis, vos copains, votre famille, vos proches, ça, c'est des contacts étroits. Alors, avoir le nombre le plus bas possible de contacts étroits, ça, c'est ce qu'on va voir pour avoir qui va nous aider à réussir à aplatir la courbe à ce moment-ci. Alors, les comportements de rester 6 pieds de loin des autres personnes, porter les masques, laver les mains, participer pas dans des parties ou rassembler ensemble et garder les nombres de contacts étroits très, très, très bas.
Merci, M. Delette. Merci, Dr. Russell. Alan Deering, 91.9, The Bend.
Thank you, Bruce. Question for Dr. Russell. Doctor, under modifications to the orange level, we are now restricted to single household bubbles. Has there been any consideration placed on people who live alone? There are so many single people out there. There's so many people that live alone. I mean, they're basically in self-isolation here, even though they're not in self-isolation, if you know what I mean. So is there any chance that we could perhaps modify the single household bubble? And by the way, I'm asking for a friend.
Yes, absolutely. Listen, the intent of the single household bubble really has been around protecting people who live alone and protecting their mental health. So the wording is being changed to clarify that. I'm so sorry that it hasn't been clear. I'm so sorry for any confusion because again, from a social determinant of health perspective, we know that when we manage COVID-19, we can't ignore all the other components of people's health and well-being. So absolutely. So the new wording that we will have for the single household bubble, which I apologize that we didn't do this from the beginning, but it certainly was the intent. Your single household bubble can be extended to a caregiver, an immediate family member who requires support, including mental, social, and emotional support. If you live alone and need mental health or other care support, a caregiver can be a formal or informal caregiver, such as a close friend or neighbor. It is only the same single household permitted to go to restaurants and other venues, including church, together. So absolutely, great question, and I'm so grateful that we had the opportunity to clarify today because it has been on my mind. I do know there was confusion around that, and certainly the intent has always been for no one to ever have to be isolated alone. Again, from a social determinants of health perspective, we know that it's so important for people who live alone to have that kind of support.
Thank you, Mr. Deering. Tim Roselle, Global TV.
Hi there. This question is for Dr. Russell. Just going back to the beginning of the Q&A portion here, it was mentioned about the backlog of testing and test results, especially in the St. John region. Can you expand on just how much of a delay we're seeing in what had normally or had recently been about a 48-hour wait? What kind of delays are we seeing right now?
So we were seeing an increased volume, as I mentioned earlier. So there's a couple of different things contributing to the issue. One is when zones go into the orange phase, they have to do more pre-op testing than previously. So that was adding to the surge in terms of the number of tests. 811 calls went up. We prioritized all the people that were symptomatic and close contacts or directed by public health to be tested. And then anybody else who had symptoms but was not part of that pool of people that public health was actually investigating, those are the people that would have had to wait a bit longer. Now, our goal is always to make sure that from the time that you get tested to the time that you get results would be 24 to 48 hours, and can be up to 72. And certainly the most important people to notify, again, from a risk perspective in terms of contact tracing and transmission of virus, are the people who are positive. So right now, to address the capacity issues, et cetera, what we're doing is we're going to have additional capacity set up at the Rope Walk Assessment Center. That's operational right now. We have a second assessment center that's being set up on Rosse Road, and that should be operational tomorrow. So we are aware of these delays. We're working really hard with our partners to get those things up and running as quickly as possible to, again, address that backlog. But just to be clear that the prioritization has been there since the outset, and again, Horizon and the lab and everyone has been quite responsive in terms of making sure that the priority tests have been done in a timely way.
Okay, thank you.
Thank you, Tim. That concludes today's update. Voilà la fin de notre mise à jour pour la journée. Merci beaucoup. Thank you, everyone.